Hello, I'm Dr. Namita Sachdeva, and I am an internal medicine doctor and a geriatrician, and I practice out of Pinnacle Care Internal Medicine in Peoria, Arizona. This is a video that our practice decided to make specifically for our patients to help them navigate the coronavirus pandemic. At the onset, I would like to say that we understand that these are very stressful and scary times for many of us. However, with certain precautions and with all the knowledge that we've accumulated over the last several months, we should be able to tide over this crisis without much of a heartbreak. So in order for us to beat the virus, our strategy needs to be three-pronged. Number one, we need to increase our immunity to enable our body to fight the infection. Number two, if we do get exposed or we are at risk of getting exposed, we need to make sure that the viral load that we are exposed to is the minimum. So less the virus that's we've been exposed to, more easier for our body to fight the infection. Number three, if we do get the infection, then there are certain breathing exercises that we need to initiate at the earliest, and there are certain body positions that we can put our body in to help our body fight the infection. So let's start. To increase our innate immunity, number one, what do we need to do? Most important, we need to make sure that we have good nourishment, and that means that we need to eat all the food that nature provided us with. So all different colored vegetables and fruits, high quality protein. We need to avoid highly inflammatory foods like sugars and processed foods and junk food. We just need to keep away from them. We need to also make sure that we are getting at least 64 ounces of water a day. Water is very important for the body, and 8-ounce glasses of water is something that we recommend that our patients try to take. Other than good nourishment and good fluids, sleep is important. 6 to 8 hours of sleep is very important. It helps our body repair any damage that has been caused by any infections or viruses. It also increases our immunity. So in the increasing immunity part, number two is after nutrition is certain vitamins. So there are certain vitamins that have been shown to increase our immunity and help our body fight against viruses. Three of them in particular are zinc. So we are recommending that our patients take 50 milligrams of zinc, vitamin D around 2,000 units to 5,000 units, and vitamin C around 500 milligram to 1,000 milligram. These vitamins are widely available in your pharmacies, in your neighborhood grocery stores. You can even order them online. So these are easy things to do, and I think during the pandemic, we all should be taking these supplements. So the third category in increasing our immunity is certain roots and spices. These roots and spices have been shown to either kill the viruses or prevent replication of viruses and also increase our immunity. And three of these I'll talk about. One is garlic. Garlic is great for decreasing replication of viruses, also helps protect against viruses. Raw garlic is what we are recommending. When you put garlic in your food and you cook it, it loses some of its benefits. So you can cut garlic into small pieces and then just take a piece with a glass of water. You can even take it with food. The next is ginger. Putting ginger in your hot soups and broths and teas is a good idea. It does increase your immunity. And the third is a spice. It's called turmeric. It's available in pills, capsule forms called Curcumin, and it's also available as yellow spice. There are lots of recipes about yellow milk online that you can get. Now, the secret of turmeric is that it needs to be taken with fat because it seems to get absorbed better with fat. So that's why people take it with milk. People who are lactose intolerant can take it with any kind of nut milk, like almond milk and coconut milk and stuff like that. So these are some of the things that we can incorporate into our daily regimen to increase our immunity. Number two is to, in case we have to get exposed or we cannot avoid exposure, we need to make sure that the viruses that we are exposed to is at minimum. So firstly, stay at home. If you can stay at home, there's no place safer than home right now. people who are over the age of 60, and people who have multiple medical problems, they are at high risk, and coronavirus can become serious in these people. I strongly recommend that you try to stay indoors, and there are lots of things that you can do. You can order your groceries online, or do curbside pickup, or even order there are certain pharmacies, there are many pharmacies which deliver medications at home, and if you can do that, that would be wonderful. Or you can pick up your medicines through drive-through. So stay home so that you can avoid exposure, and avoid getting the infection from other people who may or may not have symptoms when you're outside. Now, if you do have to go out, I would suggest you wear a mask. Mask is absolutely essential. It is going to protect you, and it's going to protect others. Your mask should cover your nose and your mouth, and if possible, you should also wear some eyeglasses, because these are the three most common routes of entrance for the virus: your nasal cavity, your oral cavity, and your eyes. So have them covered. Wash your hands at least for 20 seconds with soap and water. When you do go out, carry some disinfectant wipes with you, or some disinfectants with you, and before you enter your car, make sure you wipe your hands so that you don't carry the virus with you. If there are people who are visiting your home, obviously they need to be wearing their masks and they need to wash their hands. But when they do leave, try and sterilize and disinfect the highly used areas, like, for example, your doorknobs and your light switches and counter. Just wipe them with a disinfectant wipe, and that should be pretty good. Now, people who do go out a lot, there is some evidence, there is some data that nasal rinses and saltwater, saline nasal rinses and saltwater gargles, even better than is betadine nasal rinses and betadine gargles. They seem to kill the virus. They also wash out the viruses from these cavities. So that's something that you can do twice a day. And if you do have some, cough, cold, scratchy throat, running nose, then you definitely should do some nasal rinses and some gargles, and that will also help wash out the viruses or even kill them. Steam inhalation seems to be helping. It also helps with symptoms if you have congestion and cough. So that's something to do. Drinking warm liquids throughout the days, warm teas, broth soups is a good idea too, and it seems to be helping. So that is to decrease viral load. Now we'll go to the third and most important, is if you were to get an infection. So if you have symptoms like fever, cough, shortness of breath, some chest tightness, number one thing to do is to get in touch with your healthcare provider. Your healthcare provider might be able to prescribe some antibiotics for you to take care of any superadded infections, to give your body some help to deal with the infection. And they also might want to go ahead and test you for coronavirus. If you do have a fever, so you need to have a thermometer to check your temperature. If you do have a fever, it is imperative that either till you're tested for coronavirus, or at least for 14 days, you go into self-isolation so that you do not give infections to others. So it's important to have a thermometer. The other thing that would be a good idea to have at home is a pulse oximeter. And pulse oximeters are cheap. They're available online. I bought mine from Amazon. It comes in a box. It has batteries in it. You can put the battery. It looks like this. There's a little switch. You press it. It turns on, and then you just clip it on your finger, and it will show you your oxygenation. So mine is 97 right now. And between 95 and 100 is what we want your oxygenation to be. If it goes under 93, we have a problem, and we need to do a certain things. Obviously, other than getting in touch with your healthcare provider, there are some exercises that I would like you to start doing that will help increase your oxygenation. Now, there are some people who have lung diseases like COPDs, and emphysema and chronic bronchitis. These people might have lower baseline oxygenation in like 90, 91, and for them, if they get the infection, it becomes more serious, and we need to react more quickly, and they need to be getting in touch with their doctors sooner. These people also might be able to tolerate a little bit of less oxygenation as well. So if you do feel like you have some shortness of breath or you have some chest tightness and your pulse oxygenation is going down, then there are two things that I would like you to do. Number one is body positioning. So our lungs are like sponges. They have holes in it. And when we do get an infection, viral or a bacterial infection, there's inflammation and there's accumulation of fluid. The fluid generally accumulates in the bases of the lung. So the bottom of the lung, because of gravity, the fluid accumulates there. And it diminishes the air exchange. It affects the air exchange, and your oxygen saturation begins to drop. So if that is happening, we need to make sure that we help our body get rid of that fluid. And how do we do that? Firstly, proning. It's something, it's a body position. So when you lie down to sleep at night, you sleep on your belly. And so your lung has these little holes called alveoli, and they're mostly on the back of your chest cavity. And when you sleep on them, on your back at night, what happens, it gets compressed. Now it is filled with fluids and it's getting compressed, and it's not helping. Your oxygenation goes down and you have more difficulty breathing. So what you need to do is you need to take away the pressure. And how do you do that? You lie down on your belly. You sleep on your belly. You put a pillow underneath your chest cavity, and that is the best way and easiest way to sleep. That's what we do for our sick patients in the hospital who have any kind of lung infection or who are admitted in the ICU and are on ventilation on ventilators. We put them in a prone position, make them lie on their belly. We put a pillow underneath the chest, and that makes it easy. And then there are certain breathing techniques that you should follow. There's something called boxed breathing, and boxed breathing just means that you take a deep breath from your nose and you count till 4 for 4 seconds. Then you hold it for 4 seconds, and then you breathe out from your mouth for 4 seconds, and then you hold it for 4 seconds. So it's like a box. So how you do it is you take a deep breath and you count in your head: 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, and then you hold it: 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, and then you breathe out from your mouth. One Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. And what this forced expiration does, it empties your alveoli of the fluid and the viral particles that might be in there, and it helps with air exchange. So box breathing is something that you should probably practice every day. Start early, and it will help open up your air space, especially the bases of your lungs, and help with better air exchange. There's another exercise that you can do. Now, many people who have had infections or who are admitted in the hospital with pneumonia or COPD, they have this little apparatus called a spirometer. And basically, spirometer is breathing against resistance. So you breathe into this apparatus, and the little ball kind of goes up. And that also helps inflate your lungs and helps get rid of the fluid that is accumulated in your airways or your alveoli because of infection and inflammation. If you have a spirometer, start using it. If you don't have a spirometer, and if you have some balloons, might not be a bad idea to have some balloons in the house. If you take a large balloon like this, and what you do is you inflate it. You inflate it in 3 or 4 breaths. And so it's almost like box breathing. You take a deep breath in from your nose, and then you inflate it. Hold your breath again, take a deep breath and hold it, and then so you inflate it completely with 3 breaths. 2 breaths is even better. And this is breathing against resistance. When you breathe against resistance, you help empty your alveoli of the fluid and of the viral particles. For people who have chronic lung diseases or elderly people who cannot blow balloons, an easier way of achieving the same result is using a bottle and a straw. Any kind of straw would do. You fill up the bottle with water. You take a deep breath in, count for 4 seconds, and then hold it, and then you blow your bubbles. So deep breath out and blow your bubbles for at least 4 to 8 seconds. So these are some of the breathing exercises that would definitely help open up, clear away your air spaces and your alveoli, and help your body fight the infection, or your lungs to recover and recuperate from the infection. So these are some of the things that will help you fight the coronavirus. I hope you put these into practice. Most important, of course, is when you do suspect that you have been exposed or you have any symptoms, get in touch with your doctor so that a plan can be put into place, and you have somebody who is walking with you through this journey of getting healed and cured with the infection. It's very, very important, of course, that you need to stay calm. If your mind is calm, the body can fight better. So it's very important to stay calm. Now, most of the people who do get the infection will be able to tolerate the infection. Some have no symptoms, most have minimal symptoms, so you'll be fine. If you do need to go to the hospital after all these months of struggling to find out what we can do to help our patients, we have come up with several strategies that are working, that are helping, and if initiated in a timely manner, that increases, makes the prognosis much better. So please, please, please stay calm and talk to your healthcare provider. There are lots of things that can be done. Even if you do get the infection, there is no reason to panic. You need to stay calm. That would be it. And stay calm, protect yourself, and stay healthy. Thank you.